This recorded lecture will be going over Chapter 11, Growth and Development, Infancy through Adolescence, in the Fundamentals Evolve textbook. People will show consistency from one stage of life to another. The chapters in the unit that we will cover focus on three aspects of human development: physical, cognitive, which is the knowledge and thinking processes, and psychosocial, which is the personality and how you get along in society. Physical development will begin at conception, which we know is the union of the ovum and the sperm, then continues on into young adulthood and includes the normal changes of later adulthood. It's important to customize your care to individual patient needs, of course following our patient-centered care model. The three facets of human development are physical, cognitive, and psychosocial. They're not separated, and each one will interact with the other. We influence our own development through the choices that we make. Prenatal development. In the germinal stage of prenatal development, our prenatal development stages go through the germinal stage, the embryonic stage, and the fetal stage, and we'll also discuss multiple births. And this will be just a refresh from anatomy. In the germinal stage, we have the zygote. It travels through the fallopian tube to the uterus and becomes a blastocyst. Supportive tissues are developing. The placenta will develop to support the blastocyst and attach it to the uterine wall. The umbilical cord will carry fetal blood to and from the placenta, and amniotic fluid will surround the blastocyst and be contained in the amniotic sac. The germinal stage will last for 2 weeks after fertilization. For the next 6 weeks, the embryo will continue to grow rapidly. The heartbeat begins beating at about 3.5 weeks after conception. About 95% of the body parts are formed by the 8th week. In the fetal stage of prenatal development, organs and systems become refined and begin to function. Rapid growth will continue, and this stage will last until birth. The remaining months are the maturation time for all the remaining systems. Multiple births can occur when more than one ovum is fertilized. These babies will be called fraternal siblings. They are typical and like other siblings that share some genetic similarities. Use of fertility medications can increase the number of ova released and result in fraternal siblings. Identical siblings occur when a single zygote will separate into an early stage of cell division into 2 or more individual blastocysts. Adolescent development, a maturation from a girl into a woman. Girls will begin puberty as early as 9 or as late as 17 years of age, but the average is around about 12 years old. The pituitary hormone, which is the follicle stimulating hormone, or FSH, stimulates the ovaries to begin producing estrogen hormones. Estradiol from the ovary is responsible for the appearance of the secondary sex characteristics. In women, this will include breast development, widening of the hips, the appearance of axillary and pubic hair, and growth of the reproductive organs. Maturation from a boy into a man typically begins at puberty a little later than girls do. The average age for boys is about 14 years old. The pituitary hormone interstitial cell stimulating hormone, or ICSH, will activate the testes to produce testosterone. FSH will also play a role, and it stimulates the testes to begin producing sperm. Testosterone is responsible for the development of the male secondary sex characteristics, including enlargement of the reproductive organs, lowering of the voice, growth of facial, pubic, and axillary hair, thickened bones, increased size of skeletal muscles. The growth and development of children and adolescents can be divided into some common age groups. Prenatal, which is conception to birth. Infancy, which includes birth to 18 months. Early childhood, which is 18 months to 6 years. Middle and late childhood, which is 7 to 11 years old, and adolescence, 12 to 18 years old. Everyone's development and functional ability will be unique. A theory is an idea formed by reasoning from facts. Theories are attempts to explain something, and they are always being adapted with new information. We have multiple theories that we'll be discussing that are prominent when discussing growth and development. The first one is Freud. Sigmund Freud contributed to the understanding of personality. His psychoanalytic theory has three parts: levels of awareness, components of the personality or mind, and psychosexual stages of development. The levels of awareness consist of the conscious, subconscious, and unconscious mind. Freud stated that there are functional components of the mind. The first is the id, the body's basic primitive urges. The pleasure principle, or libido, is the main driving force of human behavior. Second is the ego, considered the executive of the mind. It is the problem solver and reality tester, and it develops with the person's interaction with the environment and the demands of the id. Third, the superego is a further development of the ego. It represents the moral component, the portion of the mind that judges, controls, and punishes. It dictates what is right and what is wrong, and it acts like a conscience. Erik Erikson was a psychologist, and he was interested in the psychosocial aspect of development. He defined 8 psychosocial stages, each identified by a psychosocial task that must be successfully mastered before the person can progress onto their next stage. Erikson also believed that cultural, social, biologic, and environmental factors contributed to development. Jean Piaget was a psychologist who developed a theory about how children learn. He said that all people are born with a need to adapt to the environment, and that ability to use knowledge increases as a child grows. Piaget stressed 2 principles that allow this to happen. First is organization, through which we try to make sense of our world. And second is adaptation, the process of discovering new information and adjusting our thinking patterns. The 4 stages of Piaget's theory are given in Table 11.3, which is found on page 149 of your textbook. As children develop, each stage will help them understand the world more thoroughly. Lawrence Kohlberg also had a theory that he developed about moral development. He defined 3 levels of moral development occurring along with cognitive growth. The first is pre-conventional reasoning. He thought that young children obeyed rules to avoid punishment. Moral values are not internalized, and typically children are in this stage until the age of 9. Then they enter conventional reasoning. At this level, children and adults will conform to more social standards. Decisions are based on understanding of the social order, laws, justice, and duty. Decisions will be made to avoid disapproval and avoid guilt. The stage will continue until about 11, and some people can remain in this stage throughout their life. Post-conventional reasoning stage, these people have internalized moral principles. They are generally law-abiding citizens and they follow their conscience. Kohlberg believed that only a minority of adults would actually achieve this level. There are many factors that influence growth and development. Heredity and environment are major factors. Family structure is also very important. How many parents are in the home? What is the parenting style? What is the socioeconomic situation? Some people think that birth order plays a part as well. Gender can also influence how a child is raised. Even though we have numerous factors affecting growth and development, there are still some various factors that exist. Patterns and stages can be anticipated. The rate of growth and development is individual. Even siblings develop at different rates. Development is lifelong. Development is multidimensional. A person's development is continual, but the rate of development will vary. Prenatal development begins at the time of conception, when the mother's ovum is fertilized by the father's sperm. A zygote is formed. Among the many influences on prenatal development is genetics. 46 chromosomes become a unique combination that will almost certainly never occur again, except in the case of identical twins. That is why each of us is different from everyone else. Prenatal development occurs in 3 stages: the germinal stage, followed by the embryonic stage, and then the fetal stage. Pregnancy can be divided into 3 trimesters. These are periods of 3 months each. A full-term pregnancy will last 40 weeks. If the baby is delivered earlier than 38 weeks of gestation, the infant is called premature. When a pregnancy ends before the fetus is viable or able to survive outside of the womb, it is called an abortion. A naturally occurring abortion is often called a miscarriage. The single most important factor in maintaining a healthy pregnancy is early and regular prenatal health care. This care allows the healthcare professional to detect signs of potential problems and intervene before the problems can become serious. A healthy outcome for both the mother and the child is always the goal. Lack of care can occur because of economics, fear, ignorance, lack of access, or other reasons. A second influence in prenatal development is the mother's health. A third influence can be the mother's age. A fourth influence is the mother's nutritional state. Women need to be well nourished before pregnancy begins and throughout their pregnancy. A woman who begins pregnancy at a healthy weight should gain approximately 25 to 35 pounds. Excessive weight gain can complicate a delivery and also make it harder to lose weight afterwards. Emotional stress is the fifth influence on pregnancy. Women who experience severe emotional stress can put the fetus at risk. The American Congress of Obstetricians and Gynecologists recommends screening pregnant women for depression during each trimester and in the postpartum phase. The sixth influence is the use of chemicals. Chemicals known to interfere in some way with fetal development include alcohol, nicotine, caffeine, some medications, and street drugs. It is becoming apparent through evidence that even casual use of any of these chemicals can be risky. For the first month of life, the baby is a neonate, or a newborn. This month is a period of adjustment for the infant as well as the new parents. Infancy extends throughout the first 18 months. Healthy newborns can manage without calories for the first 12 to 24 hours, but usually are breastfed or bottle-fed sooner. Most pediatricians recommend breastfeeding. Breast milk is perfectly designed for the newborn's digestive system, and it also provides the newborn with protective antibodies for the first few months. The primary care provider will recommend the type of formula to use. Cow's milk is not advisable for babies until 11 to 12 months of age because of possible allergic reactions. The stomach of newborns holds only an ounce or 2 at first, and that's why they need to eat often. Feeding time should provide emotional closeness. Infants should be held and talked to while being fed. Bottle feeding is a good way to involve fathers and other family members in the infant's care. For the first 6 months, babies need only breast milk or infant formula. It is best to add new foods slowly, one at a time, and see how well the baby tolerates them. Older infants enjoy finger foods, but they should not be given pieces of sausage, hot dogs, peanuts, popcorn, or hard candies that could be aspirated, inhaled into their respiratory tract. Those objects are responsible for many choking incidents, and sometimes these can be fatal for the child. At birth, the newborn's skin and scalp are covered with a vernix caseosa. This is a cheesy, waxy substance, and it protects the skin in fetal life. The baby's head will appear large in comparison to their bodies and may be temporarily misshapen. Newborns should cry spontaneously after birth. A newborn can appear helpless, but they actually have many capabilities. They have reflexes, which are instinctive protective actions. These are present at birth, including blinking, yawning, grasping, stepping, hiccuping, sucking, and swallowing. The Moro reflex or startle response can be elicited by making a loud noise near the baby, who will react by arching their back and assuming a typical posture with flexion, bending, and adduction of the extremities and fingers fanned out initially. Newborns can also express themselves by crying, and parents will quickly learn the meaning of the different cries that they make. Newborns watch everything and everyone. Their response to people and their surroundings is the way that they communicate. A typical newborn will sleep between 16 to 20 hours per day. By about 1 year of age, most infants need only a morning and afternoon nap.
The average newborn weighs 7 to 7.5 pounds and is 20 to 21 inches long. There are two categories of low birth weight babies. The first is preterm babies, who are born before 37 weeks of gestation and weigh less than 5 pounds. The second category is small for gestational age babies. These infants have a weight below the 10th percentile for their gestational age, and this means that they only 10% of babies the same age as them will weigh less than they do. All babies should double their birth weight at 5 or 6 months of age and then triple it by 1 year. They should also grow about half to 1 inch per month during the first 6 months of their life and about 3/8 an inch per month over the next 6 to 12 months. The newborn's eyes are dark blue or gray. The permanent eye color will develop by about 9 to 11 months. Newborns can hear well and they are afraid of loud noises. They prefer their mother's voice to those of other women, and they do recognize voices of other family members. The sense of touch is not well differentiated at birth, but babies need to be touched and held. Positive reinforcement is important for new parents. The baby's first teeth, the bottom incisors, will usually appear between ages 5 and 11 months. By 12 months, many babies have about 6 to 8 temporary teeth. The brain grows rapidly in infancy and early childhood. A newborn's brain will weigh about 25% of the adult brain weight, and this increases to 66% in their first year. Infants and young children need a healthy diet, including fats, for brain growth to occur. They also need stimulation for neuron connections to form. Motor development occurs at a typical pattern called cephalocaudal. This means proceeding from the head to the tail. Development. This means that babies can lift their head before they can lift their chest. They sit before they can stand. Development will proceed from the center of the body towards the outside. They'll control their shoulders before their arms and fingers. This pattern will be consistent, although the rate may vary from one child to another. Parents may need reassurance if one child develops more slowly than another one does. Children need good nutrition, health care, emotional support, and the opportunity to practice their motor skills. Safety for the helpless infant is a primary concern. According to Piaget's theory of cognitive development, babies actively construct their own cognitive world. The first cognitive stage is sensory motor. This begins with babies experiencing things about themselves. For example, becoming aware of the sensations of their body and discovering their toes. By the time babies are 8 months old, they realize that an object still exists even when they cannot see it. This is called object permanence. This is demonstrated when an infant is shown an object and then looks for it after it's hidden. Most infants will begin babbling at 3 to 6 months. Babies learn language by listening to the people around them and then imitating the sounds that they hear. Babies will often say their first word at 11 to 13 months and begin using 2-word sentences at 18 to 24 months. Caregivers can stimulate cognitive development by spending time with the baby, talking, singing, playing, and loving. Babies thrive on receiving a lot of attention and being a part of family activities. Young children are defined as those between 18 months and 6 years of age. The rate of growth in early childhood is slower than in infancy. Most young children grow 2 to 3 inches in height and gain 4 to 6 pounds each year. Heredity and the environment have been shown to influence physical development. The primary environmental influence is nutrition. At this age, some children can be fussy eaters. By age 2, their visual acuity is about 20/40. Vision can be checked by a preschool's physical exam in the primary care provider's office, and this is usually done in the kindergarten physical exam at the beginning of first grade. A full set of 24 deciduous teeth should be present by 3 years old. Toothbrushing and flossing should begin as soon as a child has teeth,
and the child should be taught and supervised as soon as motor skills allow. The first dental visit may be made when a child is 2 to 3 years old. A growth chart can monitor the child's physical growth. A child who falls below the 5th percentile or over the 95th percentile may need further evaluation because something physical might be wrong. It's important to monitor your child's growth so that any problems can be treated before they become serious. Growth progress should be steady. A milestone of this age group will be toilet training. This is the age that varies from culture to culture. Most children are physiologically ready to become bowel trained between 18 months and 2 years of age, but successful toilet training will depend on psychological readiness. Young children also learn to feed and dress themselves and become independent with many activities. This improvement of neuromuscular skills will lead to better coordination. Promote autonomy by encouraging the young adult to dress independently. The Denver Developmental Screening Test is a simple and rapid way to assess the functional ability and developmental maturity of young children before they start school. The test giver observes young children's fine and gross motor skills, language, and social ability. Gross motor skills include walking, jumping, using a tricycle, throwing and catching a ball, hopping on one foot, and balancing on one foot. Fine motor skills include stacking a pile of blocks, drawing people, and drawing houses. Piaget called the ages of 2 to 7 years the ages of pre-operational thought. This is defined as learning how to organize thoughts. The stage can also be further subdivided in the symbolic function stage and then the intuitive thought stage. The symbolic function substage states that children can think about objects, people, and events in their absence by using mental symbols of them. Children will have vivid imaginations, and they cannot easily distinguish between reality and fantasy. Young children will engage in magical thinking. Another phenomena is the child's egocentric, I am the center of the world belief. They think that their desires should be fulfilled on demand, and they cannot grasp another person's viewpoint. In the intuitive thought substage, thinking abilities will expand, thoughts are better organized, and early problem solving occurs. One highlight in young children's cognitive development is their curiosity. This often surpasses their caution, which will make safety a concern. Children lack the experience and knowledge to understand possible dangers. Childproofing a home, which is keeping cleaning supplies, medicines, and other hazards out of reach, is essential. Children at this age need instruction about dangers such as cars, crossing the streets, strangers, acceptable ways to touch and be touched. The home and play environment should be free of lead contamination to avoid and protect against lead poisoning. Parents and other caregivers are primary safety teachers. This is by example and concern. A child staying with grandparents in an unchild-proof home while the parent is sick could be at risk of poisoning. Be sure to look at the safety guidelines for infants and young children on page 155 in the orange box which says CUSIN Considerations Safety. Attention span will begin to lengthen during these years. Language develops rapidly during young childhood. The speed in which a child learns to talk is not necessarily indicative of intelligence. Young children will have lively imaginations. Some will develop an imaginary friend who can accompany them everywhere. This friend can conveniently be blamed for minor problems too. The playmate usually disappears when the child is about 5 or 6 years old. Pretend play is also imaginative. Pretending is important between about 3 and 8 years old, as the child will experiment with various roles. Erickson's second stage of development occurs from 18 months to 3 years of age. Autonomy begins to develop. Children are highly verbal and can say no with great conviction. Caregivers who are impatient and do everything for the child might cause feelings of shame and doubt to develop. Erickson's stage for ages 3 to 6 is called the initiative or willingness to try. Young children are energetic, eager, and curious. They know no fear and they want to explore the world. They are also beginning to develop a conscience and learn what is right and wrong. Young children do need to learn discipline. Many parents find that enforcing a timeout can be effective. Experts recommend that a 1 minute be used for each year of age when implementing a timeout. Children will learn gender roles during this stage. By age of 3, children know their own gender, and by the age of 6, they can usually identify another person's gender by watching their appearance and behavior. Parents and other adults can provide strong influences on the child's gender role adaptation. This occurs through their examples, the toys they provide, and the way that they treat children. There is a natural rivalry when children think that they must compete for their parents' attention. Parents should make every effort to give adequate attention to each child and to treat each child as an individual. Morals, or the values of right and wrong, are developed during young adulthood. The importance of peers increases as children get older. By 3 years of age, the child needs exposure to other children. Children naturally begin to seek friendships and experiences outside the home by the age of 6. Children's play helps them learn and understand the world around them. The play should be spontaneous and voluntary. For many young children in the United States, they need to be cared for by adults other than their parents sometimes. Childcare can be provided in a home or group setting. Topics to consider when choosing care are the approach to discipline, general child rearing practices and beliefs, activities available for the child, attention to safety and health, and a nurturing atmosphere. Parents should carefully check a daycare situation before entrusting their child to it. Group settings can provide stimulation for the child in areas that may not be available in the home setting. The child will also learn socialization skills. Middle and older children are those from ages 7 to 11 years old. They begin to express their own ideas with confidence, and they are interesting people. Children grow an average to 2 to 3 inches in height and will gain about 3 to 5 pounds in weight each year. Pre-puberty occurs by about 9 years old, and this is the beginning of sexual development. Children can run, hit a baseball, swim, and perform many other physical activities. This demonstrates increasing coordination skills. One health concern for this age group is regular dental care because permanent teeth are erupting. Getting adequate sleep is another concern, and a child at this age is often very energetic and busy. Parents should monitor their schedules so that children do not become overly busy. Young people who are properly nourished throughout their childhood will tend to be healthier as adults. Education about healthy nutrition is important at this stage because habits formed now will influence their future diet and health. Piaget called this stage of cognitive development the concrete operational thought. In this stage, children think in concrete ways about real things, and they draw conclusions based on what they see and know. Ideas are organized and fixed. Children think in black and white. They may have trouble accepting maybe situations. Cognition is apparent in their intelligence. No one knows whether heredity or environment is the greater influence on intelligence, but both are important. An IQ can be given as a score after taking a cognitive development test. IQ tests often emphasize language and mathematical skills. Children and their parents need to understand that IQ measurements are only estimates of academic abilities, and these are not measures of a person's worth or potential for academic success. Other tests can be used to measure aspects of intelligence. Kinds of intelligence and talent will include linguistic, mathematic, spatial, musical, bodily, kinesthetic, interpersonal, and intrapersonal. Children who have an IQ below 70 and problems adapting to everyday life are often considered to have special learning needs. Numerous types of learning disabilities can be identified through testing and screening procedures. The other extreme in the range of intelligence is the gifted child, who has an IQ well above average, over 140, and possesses superior talent. Gifted children will need individualized programs. Parents need to model healthy emotional skills for their children. Adults should help children learn to talk about their feelings. Children in the middle years continue to develop their self-concept, which is the way that you view yourself. Children need to feel that they are not only valuable, but also important. A comfortable relationship with parents and other adults is vital for the development of a healthy self-concept. Children in these years will begin to develop social competence. They learn coping skills for dealing with minor stressors. Erickson called the middle to late adulthood's psychosocial development stage the industry versus inferiority stage. Children are energetic and capable, and they want to accomplish things. Parents and teachers can aid the child through this stage by encouraging ideas, complimenting accomplishments, and helping a little at times. Children need support in facing their problems. They learn that their problems can be managed. The importance of peers will increase as children grow. Belonging to a group will build self-esteem. Friendships are vital. It is natural for children to begin spending more time outside of the family with friends and less time at home with the family. Some children need to spend time alone before or after school because of their parents' schedules. The decision of when this is advisable will depend on the length of time involved, the child's age, and the degree of responsibility, as well as the living situation. Most children under 11 years old should not be left alone for more than an hour. Denial of privileges can be a better tool, as a timeout is no longer going to be effective for the middle and older children. Because of the importance of friends and social events, restricting activities can be an effective technique. Psychologists have identified 3 parenting styles: permissive, authoritarian, and authoritative. The authoritative parent is often considered the ideal style. The reality is that most parents do not use only one style. 2 parents in the family may use different styles, and styles can change with additional children as parents mature. Abuse of children by parents or others can occur at any age. There are many types of abuse, including physical, sexual, emotional, neglect, and verbal, and every one is damaging to the child's development. Psychologists have determined that many abusers were themselves victims of abuse and have poor self-concepts. Healthcare workers are required in most states to report signs of abuse to social agencies or law enforcement authorities. The adolescent years begin at 12, and they will continue until age 18. Many changes occur during this stage, and it can be a confusing time in a young person's life. Adolescents experience major physical changes with the onset of puberty or sexual maturation. This occurs gradually over several years. Genetics and nutrition are the primary influences on the age at which puberty will occur. Puberty will also stimulate a growth spurt in adolescence, and growth periods can lead to fatigue. Encourage parents to help the adolescent recognize bodily self-consciousness and fatigue as a normal part of their maturation. And children can mature in different stages of puberty over several years. The difference in the rate of physical development can often be a concern for adolescents. Adolescents will seldom think that they compare favorably to their peers. They are preoccupied with their bodies and pay a lot of attention to their appearance. Safety is also a concern as adolescents expand their social networks and their activities. Because sex hormones influence thoughts and desires, it is natural for adolescents to seek sexual activity. The Centers for Disease and Control and Prevention reported that from September 2016 to December 2017, 39.5% of U.S. high school students had experienced intercourse, but only 53.8% of them had used a condom the last time they had sex. Although the body is capable of intercourse in adolescence, many young people are not prepared for the emotional aspects of sexual activity. Early sexual activity is associated with a high risk of sexually transmitted infections, pregnancy, and emotional pain.
Sex education is necessary to prevent pregnancy and STIs. Parents remain the best teachers, but they often will avoid that role. Schools are often expected to teach about sex and reproduction. Adolescents will need information about these physical changes and their sexual development. The United States has a very high rate of adolescent pregnancy. Parents, churches, and other organizations can help adolescents develop strategies for delaying or having safe sexual activity. Adolescents are learning to think in creative, abstract, logical, and idealistic ways. Piaget labeled this stage formal operations. Communication skills improve as adolescents better organize their thought in logical ways. Adolescents become more aware of other people and of what others think about them. They want to fit into society, and they also become egocentric again. Another part of egocentrism is the belief that one's own experiences are unique. Adolescents may not realize that other people have faced similar disappointments and problems too. They may believe that they are immortal. Schools that address a student's individual learning needs can aid young people in their search for meaning and identity. School and extracurricular activities are important for social activity. Emotions can be erratic when these hormones are newly released. Teens will seek to be autonomous and free of parental control, but many adolescents also yearn to have rules and to know that their parents care about them. Time spent as a family unit will often lessen when the child becomes an adolescent. As parents, trying to hold the teen too closely can lead to an estrangement. Serious conflict between parents and teens is very common when it occurs during early adolescence. By age 17 or 18, relationships with parents often become a bit smoother. Adolescents continue to learn about the world and other people during the time spent with their peers. Dating is an important adolescent experience that will help young people discover their individual identity. Most adolescents become interested in the opposite sex early in puberty, and this interest will grow as they mature. Erikson's stage for adolescence is identity versus role confusion. The adolescent struggles with questions. Who am I? What am I about? What will I do with my life? Some adolescents experiment with a variety of roles in society. This may cause conflicts with parents as teens explore alternative lifestyles or value systems. Parents of adolescents can aid them in successful psychosocial development by supporting their decisions, acknowledging their struggles, and respecting them as they mature. Discovering their identity is a primary psychosocial task for the adolescent. They will begin making decisions that will affect the rest of their lives. One of those decisions is choosing a vocation or a job. Ideology, or a belief or value system, should be well established by the end of adolescence. A moral code will begin to be incorporated. One's sexual orientation or sexual preference should also be set. When an adolescent becomes pregnant, she will need assistance in discussing options. An adolescent pregnancy is a high-risk pregnancy because the young expectant mother is still physically growing herself. Pregnant adolescents must be guided towards early prenatal care, parenting classes, and psychosocial counseling. Many adolescents will seek part-time work. First-time jobs can be valuable in teaching a strong work ethic and money management. However, depending on the number of hours worked, school grades may suffer. Sleep may also suffer, just when the body needs more sleep for growing. Family interactions can also be affected. According to the U.S. National Library of Medicine, nicotine is the substance most abused by youth and young adults, followed by alcohol and marijuana. Illegal drug use by teens is also on the rise. Nicotine use is increasing as the result of e-cigarettes and vaping is becoming increasingly common among adults because the belief is that it is not harmful. Ecstasy, a popular drug among some teens, can shrink the hippocampus, which is the part of the brain important for memory storage, by 10%. Depression may become a problem as the teen becomes isolated from usual activities and school because of the chemical abuse. Adolescents, particularly girls, who are obsessed with body image may develop severe eating disorders. Anorexia nervosa is a disorder in which food intake is severely limited and strenuous exercise may be used to control body weight.
The body becomes emaciated, and sexual development is delayed. Bulimia nervosa is characterized by binge eating, followed by inducing vomiting or using laxatives to eliminate calories from the body. Bulimia nervosa may accompany anorexia nervosa, or it can exist as a disorder by itself. Growing up in a dysfunctional family or experiencing excessive stress outside the home, such as bullying, can contribute to the development of an eating disorder. Mental health disorders are sometimes undiagnosed in adolescence. Many factors can contribute to depression in the adolescent, including the feeling of not fitting in and being bullied. According to the Cyberbullying Research Center, 34% of middle school and high school students have been victims of cyberbullying, and 12% have been involved in bullying. Causes of death among adolescents in the United States, in order of frequency, are injury-related deaths, homicide, suicide, and accidents.